Hi, everyone. I'm excited to be back with you again today with a fantastic guest who is very unique in her background. And we are working to make it less unique because we want more of this in the world. And that's Amanda Hall, and she is an OT working with the perinatal population. So you might be surprised to know OTs work with perinatal health, and what's more, they work in mental health. Yes, they do. I'm emphatically
Mhm.
shaking my head yes if you're not watching the video. Yes, they do. So I want to take just a moment to welcome Amanda, welcome to the program, and also tell you guys a little bit about her. All right, so Amanda is a registered OT. She is actually in Ontario, Canada, our friendly neighbor to the north. She owns Willow Family Wellness Occupational Therapy Services. She's certified in perinatal mental health through Postpartum Support International. She's a certified yoga teacher, nature-based therapist, and a recognized provider with the Ontario Autism Program, which is close to my heart. I'm a mom, a boy mom of three, and one of my kids are on the spectrum. So that's important work right there. She
Right.
has over 12 years of experience clinically in the hospital and community settings, covering both physical and mental health, as OTs well do. So if you're not familiar with how they do that, then this is definitely going to be the podcast for you to listen to, because OTs, I think, um, have just long time, you know, background and strong foundations in looking at a mind body point of view, and
Mhm.
something that physical therapy can learn from because we just weren't taught to do that. But OTs are the kind of original mind body therapist, I think. So, speaking a little bit about Amanda's personal experience after the birth of her two babies, that's the passion was born. She really birthed three things: two babies and a bunch of passion for helping women as they transition into their motherhood journey. And I get tangled up on those words because there's a lot, like, in my heart and my head when I say motherhood journey, being a mom of three. It's just I I can't wait to get into that discussion with you. But it's biopsychosocial, it's physical, mental,
Mhm.
spiritual, it's everything. Um, but speaking about you personally, about Amanda personally, she loves spending time in nature, finding great benefit from bringing that natural element to client interactions. And she also adjunct teaches, because she's, spare time here, in the OT program at Queen's University. And then she coordinates fieldwork experiences and teaching in the mental health course, which is fantastic. I am a huge advocate for anyone in this mental health space as a PT or OT, because it's not something that we skipped, but we also didn't have classes and courses in it either. Kind of like nutrition's important, but nobody talked about it, and they
Right.
don't teach it in medical school either. So let's talk about it today. Tell me
Sounds
how
great.
you fell into such an incredible blend of expertise and services. Yeah.
Yeah, well, first of all, just thanks for such a nice opening there. It's certainly my passion in maternal health and mental health and physical health. And so it really came about when I recognized that we really are lacking services where I am, and we really needed to bring in awareness. And it really spoke to the piece about OT that I love is the advocacy piece and bringing awareness to what women are really going through every day. And we have really poor rates, unfortunately, around our country of screening for postpartum mood disorder. When when I do some of my education that I've done since being a student in the program officially, I really was looking at how is pain manifested in the body? And very often we have this mental health component that comes along with that. And when we speak with a lot of women who are going through a challenging time, there is this physical pain that also is in conjunction with it. And that really spoke to me. And a lot of these experiences that I've had with my clients, my own experiences, have really shaped where I am right now. Um, it's hard breaking into the medical world with these kinds of concepts, though, at times, which is challenging.
Yeah, it is. Can you take a moment? I know we could spend the entire time talking about the challenges, but if you could just take a snippet of that to give our listeners a feel for what are some of the pushbacks? Because really what we're talking about is getting
Mhm.
moms the help they need and
Absolutely.
mental health and otherwise. But what are some of the things that you realized weren't okay and like some of the pushback that you got so that moms can be kind of on the up and up of what are my rights? What should I expect? What do I have a right to ask for kind of thing?
Absolutely. So, right back when I first started this journey in 2019, one of the moms that I worked with had just been discharged from having a cesarean birth, and she had no idea how to get out of bed, how to get up off the toilet, how to use uh, sorry, I should back up. She had a walker that she had to use for a short term because of some other complications. So
Hmm.
she had no idea how she was going to use a walker, heal from this major abdominal surgery, and care for her baby. And she was discharged with all of these unknowns. And so here she is now at home, 3 weeks postpartum, and has no idea who she is anymore, lost complete identity with herself, is in a really down state, not in a great state mentally. And yet her healthcare providers are telling her it's just the baby blues. You'll get over it. It's okay.
Mm, that's so terrible. It's worth pause because I know that many of our listeners are going to say, "Oh, that's me. I felt
Right?
that too."
Yeah.
And instead of actually being ushered in to say, "Oh, this isn't your fault." You're actually blamed for it. Like, "Oh,
Right.
this is your fault you're in this situation, so you'll just spring out of it magically somehow."
Right.
And it's also worth talking about that, in the United States, in Canada, how much paid is there paid the situation of paid leave because we have different
Yes.
burdens in
Yes.
the US and Canada. So
Very much so.
how does that look? Um, because not
Yeah.
everyone is employed by a system that's going to provide leave in the US, and even when they do, it's like it's just minimal, it's nominal, and it's usually without pay too.
Yes.
So describe to the listener, a little bit about that, not to get too far off topic, but with the
Sure.
leave situation in Canada.
So we are very fortunate in Canada. While our healthcare system is certainly not perfect by any means, but we
Yeah.
are very fortunate to have paid leave.
Okay.
So right now, employers are required to hold a person's job up to 18 months postpartum. Then you can be off on leave, paid leave, for 18 months. For the first 12 months or 6 months, I believe it is actually, you get um, a lot of employers will provide a top up, is what we call it. So for example, I was with a big hospital organization and I was able to get topped up on my maternity leave to 85% of my income for the
A-
first 6 months off.
And
So it
that
makes a
is,
big difference.
yeah. So what if someone's self-employed? What if they have their own business? Does that still apply to them?
Yes, you just don't get that additional top up. So you get 55%
Okay.
of your income typically for the
Okay.
previous year from the government. And
Okay.
then that does go down after the first 6 months. And then it will be a smaller amount that you would get because you still get the same chunk of money, whether you go 12 months or 18 months.
Ah,
It's
yeah.
just spread out over 18 months. But the nice thing is that employers are required to hold your job for 18 months if you choose to be off that length of time.
Right. And so I think that as we talk about the impact of mental health, one of the things that I want to bring up is that a lot of women will sit in shame and
Mhm.
self-blame. And what I want them to realize, and I think that, this is, you'd probably agree with me about this, is that you we we want to help lift women out of that self-blame and shame game, because can you thrive in an environment which doesn't give you the resources to actually even heal
Right,
fully?
exactly.
Yeah.
That is just it. And it is really looking at society's expectations for new moms. There's a reason why we don't tell people or feel comfortable telling people we're even pregnant for the first 3 months.
Yeah.
Because goodness gracious, if you have a miscarriage and then you've got to talk about something really uncomfortable and nobody wants to hear about your miscarriage,
Right.
right? it's
Yeah.
that's the rhetoric that we're being
Yeah.
told, and that in itself needs to change. And
Yeah.
um, yeah, we just have a lot of work in society to do. I think whether we're in Canada or the US, I think that there's a lot of work around the world, especially to support women as we go through these challenges that we have no control over them. And yet we're being stigmatized and shunned for some of these experiences, which it doesn't make sense. And it's not just around childbirth, it's around anything that women experience,
Hmm.
really.
Absolutely. Whether it is going through a hysterectomy, which is a major abdominal surgery,
Absolutely.
and then getting no care. There's
Yep.
no standard of care for post op abdominal surgery, which could
No,
actually then it crosses genders. Men aren't getting that care either. Women are
absolutely.
not getting, no one is getting that care that they need. So I just want to and really drive home the message to the listener that if you're suffering from some of these situations, regardless of gender at this point, that the standards of care that should be nurturing you back towards thriving again are not even really in place yet. We just
Not
don't have
yet.
the standards of care. And so that's really, it's why I was excited to talk to you today, because you and other people like you doing similar work are trying to create and forge standards of care where there aren't any. And so
Mhm.
I want to know how for you, how did that, the occupational therapy as your, profession, and you as a mom with obvious, you have your own perinatal health concerns and mental health. How did all that kind of converge to get you where you are now in the work you're doing?
Oh, it's a great question. I was working rehab in a rehab hospital for a number of years and recognizing that I just hadn't found my niche as an OT at that point. I knew that I was working under certain parameters, being in a publicly funded hospital. There were things that I could and could not do. And so I ended up just quitting my job with
Wow.
nothing else to go to.
Wow.
I very fortunate to be in a position where my husband was gainfully employed and I was able to do that. And it was one of the scariest things I've ever done, but one of the most amazing things at the same time. Looking back on it, it took a lot of courage to be able to say, you know what, this isn't feeding my soul right now, and I need a change. That's when I really did some soul searching, and I stayed home with my daughter at that point, and then became pregnant with my son, and decided to just stay home with him and just figure out who I am as a person. If I'm not resonating with my OT identity at that point, who am I, right?
Yeah.
And so going into a postpartum phase where I also was experiencing postpartum mood disorder, anxiety, intrusive thoughts, you name it. I feel as though I had the gamut full of it. And being a mental health provider as well, feeling like I should know these signs and should know these symptoms. And yet I was in denial. And it was
Yeah.
probably 10 months before I got diagnosed with postpartum mood and anxiety disorder. And I don't want other moms to have to wait that long, right? And it doesn't matter whether you are a mental health provider or whether you are an architect. We all are going to be experiencing these experiences in different ways, but
Hmm.
very often our mood is going to be impacted whether we expect it to or not, right?
Right. Right.
Um, and I think my biggest point of awakening for me was I could open up my own business. I can do this, and having the faith that I am able to provide a service through my own experience and have my own experiences as I was healing drive my passion to help others and advocate for others, and know that I could really use my OT skills to provide a service that was something very unique in our area.
Yeah.
And so that's really how the two collided when I realized I just needed to go out on my own and do my own thing and be responsible for my own career as opposed to working with a hospital, which is nothing wrong with that. If it's for that person, teach
Hmm.
their own. But for me, it wasn't serving my needs any longer.
Yeah. It wasn't where It wasn't, I always use music analogies. It wasn't resonating.
Yes, exactly. It certainly
um,
wasn't. And I also am certified in nature-based therapy, and so that's challenging to bring into a hospital setting. And I was really feeling a calling to incorporate some of that into the work that I do as well. And so, actually, this morning I just had a mom who was going through a hard time. We just sat in the forest this morning and chatted through some of the things that she's experiencing and putting a plan together for some support. And we just had a mindful moment in the forest, listening to the birds and the squirrels that were running around and the wind and the leaves. And it was a very healing place to be this morning for both of us, I think.
yeah. I think that I just want to call out, in you sharing your story, to go back to the beginning of what you were talking about. You're sharing your story as courageous and brave and um, kind of the what we all hope for when we're going through something really hard. We
Right.
hope that we can take it and because it's easy for us to do the other thing, which is to go, why me? Why is this happening to me?
Oh, there was
Instead,
probably a bit of that though,
yeah,
too.
we all start there, and it's okay to like,
Mhm.
I'm just like wallow. If you can't see what I'm doing because you're not watching the video, I'm just kind of like wallowing in the mud. And that's part of the process too, is to kind of
Mhm.
grieve a little bit, like this
Yeah,
isn't what I thought it was going to be. But then to be able to, in hearing your story, to say and hear that shift and that evolution of, well, because there's something better. There's something
right.
better that I can do, that for many of us, um, it's not going to make any more money, for example. Like, so it's not
No,
money driving us. You end up, and I think people don't understand this about when you say, well, I quit my job. Oh, but you have a husband that works, so that's fine. Actually, not when you have a kid, not when you have a second kid, not when
no,
you're raising the next generation. And it is expensive to raise
it
the next
is.
generation. And in the United States, we get absolutely zero help to do that. So in choosing to start a family, you're choosing to help fund Medicare one day with the
Right,
birth of those children, who will take care of
right.
other people who may or may not have children. And so it's a big undertaking. And I think that um, it's probably easy for a bitter society to say, oh, it's easy for her to say that she did that because she had A, B, or C.
Yeah,
But when you don't have the basic support and you come home and you realize, gosh, maybe I have postpartum mood issues because of the lack of support and culture
absolutely.
and society. And if we had that, we would have lower levels. But until
Mhm.
we change awareness, until we reach more people, which is what I'm hoping this podcast is going to do,
Yeah,
until we reach more people to say, hey, don't beat yourself up, don't blame yourself.
no,
Um, you didn't choose to drop into this state of what some people callously would call, oh, they just feel sorry for themselves, they
absolutely.
chose to have a family, so therefore they need to buck up. Actually, not so much.
Yeah,
The system is what needs to buck up and support
absolutely.
our people, our citizens, no matter
Mhm.
what country they belong to. And if we had that, it's kind of like what's good for mom. Like if mom is happy, everybody's happy, kind of thing.
Oh, completely. Well, and
Yeah.
I also do some work in child development, and
Oh,
I
that, yes,
lecture on infant mental
yeah,
health,
which is
right?
amazing. What a hand in hand thing to do, is to
Yeah.
support the families who are having, increasingly, and we could talk about this all day, I'm sure, neurodivergent experiences in our families. That is a whole level of stress, that then you have one kid who may be neurodivergent,
Mhm.
and diverse and wonderful and lovely, but our system is also not set up to accept those children and the way
No,
they learn and the way they
no.
experience the world. So that
Yeah,
makes me take a big, exhale for all those people. I'm one of them, as an autism mom, to
yeah.
say, wow, we can do so much better. Which brings me to what you do at Willow Family OT, which you can check out at the .com, willowfamilyot.com. Tell me what you're doing to move the needle. Like, we've clearly outlined the problem. and
Right.
probably got people fired up listening to it. I get fired up. I get
Mhm.
appropriately angry because
I do too.
moms shouldn't be blamed,
Mhm.
families shouldn't be blamed when they just don't have good support. So what have you been doing? What are you busy doing, moving the needle about?
Oh my goodness. So a lot of education. So we are providing education for employers on, return to work plans for moms from maternity leave. What is that support that moms might need as they come back, especially, being a very fortunate and privileged mother to have 12 months off with my baby. I can't imagine going back after 3 weeks, three
Yeah.
months,
I
and
was
leaving a
5
newborn.
days with my
Oh
first.
my goodness.
I was
My heart
crying,
just my heart
yeah.
breaks for that because there's so much in our research that shows that those mom and baby bonds for those first little while is so crucial.
Critical.
And
Yeah.
it's such a protective measure for mom's mental health to be able to have her baby by her side, to not be separated because of employment reasons,
Mhm.
right?
Yeah.
That aside, even after a year or so, going back into the workforce can be really challenging for so many moms.
Mhm.
And we always talk about separation anxiety with children, but we don't talk about separation anxiety with moms,
That is
right?
so true.
It
Ah,
really
that's so
is.
true.
And how many times can moms relate to dropping their baby off at daycare and they bawl the entire way to work
Mhm.
because this is the first time they're away from their child. And now they need to go to work and expected to fulfill the same demands at the same time frame that they were a
Yeah.
year ago or pre-baby,
Yeah.
which even if it's not a year ago, even if it's 5 days, goodness gracious, but if it's a shorter amount of time,
Mhm. And they're
your body
expected
has
to.
changed.
Mhm. And your
Your brain
identity
has
has
changed.
changed.
Identity. You are a
Yeah.
whole new person inside and
Mhm.
out. And so the expectations of just picking up where you left off after having a baby is not realistic, right?
Mhm.
And so we're really trying to provide some education to employers and to parents to be able to advocate for themselves of, maybe we need a graduated return to work following pregnancy and postpartum.
Mhm.
And that even includes women who have experienced a miscarriage.
Yeah.
We're seeing so many individuals that are losing pregnancies or young infants and are still expected to just jump right back into work where they left off
Right.
as if
It's
nothing
entirely
happened.
like swept under the rug
Absolutely.
as if it was nothing. Yeah.
Yeah, absolutely. And so that's an aspect. Another piece of what I'm doing is ensuring that women know that they're able to request a screen for postpartum mood disorder and that it doesn't need to happen in the postpartum period. So, what many women in my area are told is that there's no need to really screen for postpartum mood disorders while you're pregnant because it's just so in flux, anyways. That's really not best practices. According to PSI, the Postpartum Support International, they've got this lovely document on their website that shows what best practices are for postpartum screening. And well, perinatal screening is what we should be calling it, really. And so, using the Edinburgh Postnatal Depression Screen is best practices right now for this, and it is free, open source online. So, I encourage anybody who's curious to go and check it out. It is something that you can do yourself. Where I have had some roadblocks that have been quite challenging is that healthcare providers in our medicalized system don't want to do this because they say you can't diagnose postpartum mood and anxiety disorders during pregnancy, or you can't diagnose postpartum mood and anxiety disorders within 3 months of postpartum because it's just the hormones during pregnancy or it's just the fluctuation of baby blues. And so let's not even screen because it's just not worth the while because we can't diagnose anyways. So I turn that around and I say, my question to you is why do we need a diagnosis? If
Mhm.
this screen can tell us that there is a mother who's struggling and it allows open conversation to say to that mom, I really do care about how you're experiencing things right now. Let's just do this together and see what comes out of it. And then we can move on from there to figure out what domain in this screening shows true that you could really use some extra supports right now. That is
Absolutely.
what we need to use screening tools for, not as a diagnostic tool.
Yeah, I fully agree because we are such a diagnosis seeking system in
Yes,
the biomedical, allopathic system of healthcare, where it's almost rabid diagnosis seeking. Like,
right.
if I can't find a diagnosis, it doesn't exist, instead of saying, but the problem still exists and it's not
Absolutely.
being addressed.
Mhm.
And moms and kids and families are being harmed for it. It serves no one to skip over screening.
No.
I'm wondering if there's another, because I have heard this multiple times, and I was aware of it as a pelvic PT and screening myself and making sure I was trying my best to do self-care, because I was self-employed and was forced to go back way too early.
Right.
Is that moms are afraid to be screened because they're feeling like social services is looking over their shoulders, just looking for a
Absolutely.
reason to come into the home and take their kids.
Mhm. Absolutely. That is one of the biggest things that I hear about because if a mom gets screened and it shows that they're not coping or they're struggling or they're having these intrusive thoughts, then all of a sudden they're a bad mom. And
Hmm.
all of a sudden somebody's going to drop in their house and take their kids away. Right. And that's a very real anxiety that many, many moms feel. And that is such a shame. I that just it really does break my heart that that is the reason why people are so, reluctant to seek support and to seek help. I don't know the best way around it, unfortunately. That's one of these systemic issues that we're faced with that hopefully just with more education, and understanding that, it's nothing that the mom has done. It's not warranting, to take their children away. It doesn't mean that she's a bad mother. It means that she just needs a little extra support, and you know what? Who doesn't during that time of life,
Hmm.
right?
I often think about this in a way of, because after having one, two, three kids, and the burden and the expense
Mhm.
just continues to increase, and there's very little sensitivity or compassion for the most part to it. People are like, "Buck up, Buttercup."
Because we
Um,
chose this,
right,
right?
you chose it, so buck up, Buttercup. And but I often think about it this way: if there's a very real threat, I even found myself on a postpartum inventory, because the only person that would screen for it is the pediatrician in the United States.
Really?
ACOG in the United States, and it could have
Mm.
changed, but when I was teaching perinatal classes, it wasn't recommended
Wow.
to actually provide the inventory. Your PCP is not taking it. The only person that was going to take it is the pediatrician. Now, how likely is a mom to just check, I'm severely incapacitated by feelings that I'm having, at the pediatrician's office when you're right there?
They're not going to.
They're not going to. They're not going to. And
No.
and I found myself in the same situation. Years later, my oldest, they're in high school now. But I think about it this way, because I also have a child on the spectrum. I know how, if we think back to how children were treated that didn't assimilate and didn't learn well, and
Mm.
these issues weren't identified in them in the 50s and the 60s, right?
Right.
And then we went through a period of time of ostracizing them, pulling them out of classrooms, sending
Yeah.
them to, special classrooms where they weren't integrated. It's kind of how we're treating mothers now, of them
Yeah.
living under that threat of getting pulled, or their kids getting pulled, or them being
Absolutely.
ostracized. I'm hoping that we're not that far off of just being through in the school system, where my oldest, when he was in eighth grade, um, um, went through that period of transition where things were getting better all the time
Right.
for him,
Yes. Yeah.
because of that integration, that compassion, that understanding, that destigmatization
Absolutely.
of having any kind of diagnosis at all. And so it's not pie in the sky, I think, to think that hopefully, I said think twice in a row, but to hopefully feel like we can go in that direction of how we
Mhm.
are inclusive towards those
Yeah.
children now. They are integrated into the classroom, and you're seeing improvements across
Absolutely.
the spectrum, literally across the spectrum in them. That, can we think of mental health in the perinatal population that way? Instead of
Yeah.
ostracizing and finger
Kind of
pointing and
incredible.
bullying, can we be compassionate? Can we understand? Can we integrate systems
Mhm.
that will actually, why can't a therapist come into the home? Why don't we have home care the way other countries do?
Right. Yes,
Other
absolutely.
continents do, because I don't know if you guys have mental health, in the home or not, but we don't.
We do a little bit, but I would say it's certainly more focused on physical health. Um,
Yeah.
and so, most often, the times when a community therapist would be going in to see somebody significantly post-op from a C-section or from other complications at birth, those are the times that we see OTs and PTs going into the home. Otherwise, it's not happening, right?
Yeah.
And the onus is really on that mom to reach out for the help. And my hope is that with more education, more advocacy, we're able to actually say, look, you've got your 6 well baby visits that are going to happen for your child. And these three, let's start there, are specifically for you. And we're going to follow you. And we're going to ask, hey, how is the bleeding after pregnancy or after your delivery? How is your mental health? How is your nutrition? How is your physical ability and stamina?
Hmm.
Um, and
How's your
all of these
support system? Yeah.
support system from, there's so many different aspects that are just not asked. And we are in a place where moms are and women are really expected to reach out for that support.
Yeah.
We also can't forget all the support partners. Gender aside, if somebody is supporting this person going through a recent birth, there's a mental health component to that as well. We know that fathers specifically, which is where the research is, that 1 in 10 specifically are experiencing some sort of mood adjustments or changes postpartum. We don't recognize that in our society either. And so
Hmm.
that's where my practice is a very family focused practice where we look at the family as a unit. We don't look at them as siloed individuals living alongside each other. We are looking at them as an integrated unit, which I think is so important for
Yeah.
higher quality care. And unfortunately, when we get into some of our publicly funded supports that we have in healthcare, the way how funding is allocated, we're not able to look at each person
Hmm.
more so than just that person, right? We can't look
Right.
at the roles that they hold.
That's
Um,
true. That's so true in the United States too. In the insurance-based system,
right,
you can't even look at another joint. I mean, you're
right,
like stuck looking at one single thing. You cannot treat the entire
absolutely.
person, much less the entire, like family system, which is
Yeah,
what's necessary
it
to
is.
truly ensure safety all the way through the process of
Mhm.
healing.
Absolutely. A perfect example is just last week I was meeting with a new client. This child was 6 years old, recently diagnosed with ADHD and autism, having a really, really hard time at school. And as I'm talking to mom, she starts to get upset. And we're talking about the experiences of her child. And she just said, you know what? My whole childhood finally makes sense through the eyes of my son
Mm,
because I'm realizing I have these challenges too, but nobody's ever talked to me about them.
wow.
And my whole childhood now makes so much sense why everything was so hard for me. And that just was like, oh, right in my heart.
Yeah.
So that's where we transitioned our work from her child. He came and played in the forest, but we started working with mom and we started doing creating a sensory profile with mom. We created an understanding of what her executive functioning was like.
Mm,
Where does she require some of these supports? Because she's not able to support her child in the way that she wants to because she's not feeling supported.
yeah.
So,
Explain
how can we do that?
executive. Yeah, explain
Oh,
executive
yeah,
functioning to the listener, because
of course.
as an autism mom, I'm like, yep, I totally feel that. And I'm shaking my head, but that might be the first time they've ever heard that
Of
word.
course, yeah. So executive functioning is really our system that our cognitive systems to be able to plan and organize time efficiently, being able to follow directions, being able to problem solve. Really, all of these pieces of, okay, I need to get from A to B. How am I going to get there? And what do I need to bring with me in order to do that? That's all your executive function pieces that make that happen successfully.
Hmm.
And so, with a lot of individuals that have a diagnosis of ADHD or even just experiences that are aligned with ADHD, not just a diagnosis, these are the areas where they're struggling in. So these are the kiddos that are looking like they're not paying attention in the classroom.
Yeah.
These are the moms that might just need to check out and scroll their phone because they're feeling overwhelmed because
Hmm.
they everything is just harder. Everything for somebody who might have ADHD and an associated executive function disorder, think of it as it takes them twice as many steps as it would for us without an executive functioning disorder
Hmm.
to do a complete task. So making dinner is much more complex than what it would be for somebody who doesn't have an executive functioning disorder.
Yeah. I often think about it in terms of, which I think is why um, doing like small tasks, like scaffolded tasks, like
Yes.
Legos, the way the book in the Lego is, here's your first piece,
Yes, I
here's your
love
second
those
piece.
kits. Yeah.
Yeah. And it can be very reorganizing, I think, maybe even therapeutic, because all my kids actually did Legos. But I think about executive functioning like that. It's like having a
Yes.
really good Legos book to help you scaffold your
Hmm.
life, not
I
just putting
love that
that,
example.
not just putting a rocket engine together or something,
Yes.
or The Hobbit, or something like
Yeah,
that. Piece from The Hobbit.
absolutely.
um, so you might be listening and going, oh gosh, I have, difficulty scaffolding my own day or
Yes.
goals, or maybe it could be 5-year goals, not just how you're going to complete your
Yep.
day. It could be a kid's school project or a project at
Mhm.
work that feels really overwhelming, and it agitates you, and maybe you lash out
Mhm.
at other people and you just don't understand why. So
Absolutely.
it's encouraging to me to say, oh, if you're feeling that, that could be a reason to go seek someone
Mhm.
like yourself, or someone else who can help identify that, and destigmatize it for you. You're not
Yes,
stupid, you're not incapable, you're smart, you're intelligent, you're fully capable of doing this. Your brain just works differently, and it's
absolutely.
society's fault for not understanding the way different brains
Right?
work. We have so much
Yes.
to understand and discover about
Mhm.
our brains. And
Yeah.
so I never want someone to think because they have any kind of diagnosis at all, ASD,
Mhm.
ADHD, anything at all, mental health wise, anxiety, depression, that it's somehow you're just a weak person. That's just
Exactly.
not true at all.
Yeah, absolutely. And when we think about the terminology neurodivergent, divergent is synonymous with something negative or something bad or not normal, right? So my hope is that we can at times get away from that word
Mm-hmm.
divergent because
Mm-hmm.
what are they diverging from?
Mm-hmm.
What is the standard that they're divergent from? And really move into more of that neurodiversity. And when I was
Diversity.
speaking to somebody around the concept of neurodiversity, they were saying, aren't we all just different? Wouldn't that apply to everybody?
Mm-hmm.
And that,
Yes.
you know what? Yeah, actually it
Yeah.
could.
Here's the umbrella of neurodiversity, and then we're all under here somewhere. And I caught
Exactly.
myself doing that earlier, is to say, divergent isn't synonymous with diversity. In my
Right.
mind, because I don't think of it as a stigma, they are kind of synonymous, but not to the general, not to most people. They think
Yeah.
divergent is like some kind of horror movie or something, when it really isn't. We can just
Yeah,
think of it as that diversity. But yeah, I think of it as an umbrella, and all the beautiful little raindrops coming off of it are, we all
absolutely.
fit under there somewhere. We just
Mhm.
don't understand enough about the brain to be able to meet everybody where they are yet, I
Exactly.
think.
Absolutely.
Yeah.
And so flipping that back into some of the work I've done is working with moms understanding why sensory births work,
Mm.
why bringing in components of, that tap into our sensory needs, why those are really important. Some of the work I do with doulas is really looking at how can we support the birth process for folks that might feel a little bit more on the neurodiverse scale.
Yeah.
So, we know that there's fonts that are more friendly for folks that identify as being neurodiverse. So, if you're giving some written information, make sure it's in something like Arial that is widely accepted across differences like learning disabilities and
Yeah.
different things like that. giving information not just verbally, but also on paper,
Yes.
providing resources, links to
Mhm.
resources that are videos for,
Mhm.
tapping into all of those people who have different learning styles.
Yeah.
So
So it,
my thing is, why can't we apply all this to the birth process and recovery process as well, and
that's so important.
make it more inclusive?
And can you spend just like I know we don't have a ton of time for it. We could just talk all afternoon about it. But the whole sensory motor integration piece and the sensory piece is so important. And I don't think this would be my wish for creating safety for
Yeah,
everybody in healthcare, but particularly for women and girls and people who identify as female because there's so much discrimination and stigmatization of what we go through. I wish that we all graduated from high school with basic body knowledge, knowledge of
yes,
sensory motor integration, that kind of thing. So I think most people may not get how critical that sensory piece is.
right.
Can you spend just a little bit, more time with in regards
Mhm,
to the birth process, how that
mhm,
looks if we're being sensitive, if we're really plugging in, and
mhm.
which describes your work with doulas, which I absolutely love too.
I love doulas. So, I mean, this is, again, I could talk about this for hours because this is a complex topic, but it's also something that I'm so passionate about and is near and dear to my heart for sure. And one of the things that we are all sensory beings, every single one of us. We have our five senses, our five core senses, but then we also have the three other senses of our vestibular system, our proprioceptive system, so movement, balance. And then we've also got our interoceptive system, which are all those internal signals that our body is telling us, which when somebody has any type of neurodiversity, interoception is one of those senses that can be really misunderstood and misguided, lacking interpretation of. When we are going through the birthing process, there is so much happening in our body that we can't understand necessarily all of the signs that our body is telling us from a sensory perspective.
Hmm.
So, knowing that it is probably one of the most overwhelming sensory experiences we may ever experience, in addition to knowing that we have a lack of control, and that in itself might increase our sense of overwhelm and sensory overload, increasing us to becoming more dysregulated, increasing our risk of becoming more anxious and more stressed. So, in an ideal world, if we all had a really lovely understanding of how our sensory motor experience worked, we would hopefully be able to be much more self regulated and much more aware of how our body is reacting to different signals. How can we interpret and know the proper response or behavior that is your body needs in that moment when it comes to interoception mostly? So, with interoception, if you need to go to the bathroom, right? You understand that you get a sensation in your pelvic region telling you that you might need to go to the bathroom, your bladder's full, but maybe you don't interpret that signal as that's what it is, right? And maybe you're like, oh, yeah, I feel kind of weird in my belly, but I'm not too sure why. And then you have a urinary accident, right? This is very common for people who have this disconnect between their brain and body and interpreting their interoceptive system. And so, if we're able to recognize what that signal is, give it a name and a meaning, and then attach a behavior to it, then we're able to really regulate ourselves in a much greater way. So, if we have this understanding of our body prior to going into labor and delivery, imagine how we might be feeling like we're a bit more in control of our body because we can respond in a better way. And this
Yeah.
is where doulas come in such a beautiful way because I've been sharing a lot of this information and education with doulas that are in our area here who are supporting women through these deliveries to be able to understand what their body is needing. So we do a lot of education pre-birth to prepare for that. How many women do we know that they feel comfortable to put in a pair of noise canceling earbuds
Hmm.
during labor? Not
Hmm.
many. But
Hmm.
if you are being distracted from being able to self regulate and be calm in the moments of delivery, because there's a lot of beeping and noises coming from the background that are really triggering your nervous system into a fight or flight response because it's an overstimulation.
Yeah.
Then let's do something because we can't get rid of the beeping. So let's do something with us to try and mitigate that
Yeah.
overwhelm.
Yeah, the message here is that having this knowledge that everyone has perceives sensory input different. Everyone perceives
Absolutely.
motor input different and has different sensations and actions, the motor parts of what
Mhm.
help us move. That's going to be different also. We have to acknowledge, and I think this is a really important thing to stop um, uh, people from beating themselves up, stop women from beating themselves up, giving themselves a hard time, and feeling such shame and guilt is think about how birth has been set up in the US. It has been set up in the US and Canada and other places with no knowledge, no sensitivity whatsoever to someone's sensory motor perception.
No, not
None,
at all.
none. But you
Nope.
think about nature. And the
Mhm.
piece that you work with in nature is so interesting to me because if you think about nature, and I use this a lot when I'm um, doing birth prep training, kind of push
Right.
prep training with my patients and clients is think about an animal in the woods. What do they need in order for birth to progress
Totally.
and for them to be able to give birth safely? They actually need quiet. They don't
Yeah.
need any of that sensory input. They have to focus. And yet
Mhm.
we're expected to, for birth to progress with all of these inputs that are foreign to us.
Yeah.
And like, that's saying that they're able to handle that, right? What if they come
Right.
in with birth trauma? What if they come in with
Absolutely.
PTSD?
Mhm.
And so if you are able to realize our systems aren't currently set up to be sensitive to your actual needs as a
Not at all.
birthing person,
Mm-mm.
then you can be more self-compassionate and realize, oh, it isn't me, it's the system.
Mhm.
And then the other thing that you mentioned that was really important, and I want to bring in a little nerdy science here, um, is that when you look at women, this is specifically to women because I teach continuing education on trauma informed practice. When you
Yes, I
look
do too.
at, yes, kindred spirits,
I love
um,
it.
when you look at who responds best when you have complex PTSD, that kind of treatment resistant, what clinicians would
Mhm.
or researchers would throw into the bin of hard to treat, tough to treat,
Absolutely.
complex to treat. The two things that move the needle the most for them is improving exactly what you were saying: interoception, how do we
Mhm.
feel, and proprioception, where am I in space and how is my
Exactly.
body moving.
Absolutely.
And that's why mind body medicine is so amazing. It's why OT and PT can be so effective in this population. And you may
Yes.
not have ever thought about that before, listening to this, but now you do. Now you can realize how many empowering possibilities there are to seek out a perinatal OT or a PT in your area and see what kind of work they're doing, or reach directly out to Amanda at willowfamilyot.com, because I'm sure, like many practices, my practice does the same. We will field those emails. We will answer your
Mhm.
questions. We will spend a little bit of time on a free consult trying to point you in the right direction. Whether or not you come to see us is not the point. It's empowering each person to know what their rights and options are so they can get the care they
Absolutely.
deserve.
Oh, that's very well put. Yes, I agree 100%.
Yeah, yeah.
Mhm.
I absolutely love the work that you're doing.
Thank you.
I'm going to have a couple of rapid fire questions I always end
Sure.
with
Yeah.
because they're always inspiring to me to see kind of what are you reading? What are you listening to? Like what's moving you these days? So,
Yes.
is there like a book or a song that's kind of like, that you're currently reading or a song that you're going to lately?
So it's, I wish it was maybe more interesting because I find this fascinating. This is a book I've just picked up, and of course, it's right beside me because I don't go far without it. But this is the one I've got right now, and it's Canadian Birth Stories, an anthology, and it's
Oh,
actually just been
wow.
published by our Doula Support Foundation here in Kingston.
Oh, wonderful.
So it
I would
is just a
cry.
combination of
Oh,
amazing birth stories, and that is what I'm reading right now.
Oh, wow. I would have like I'd need a whole case of tissues beside me. I can't watch a birth. I can't hear a birth story. I can't read a birth story without actually just completely melting because every
Similar.
single one is sacred. Yeah.
Absolutely, it is. Yes, this has been a very special read. So I highly recommend it. And
All
it
right.
supports this nonprofit doula support foundation in town.
Wonderful. Thank you
Not that
very
I
much.
meant to plug them in any way, but just
Can they
I
find
rarely
that
see.
at a particular website or
You can
anywhere?
get it off of Amazon.
Okay, anywhere
Yep,
where you buy your books. Lots of people
yep.
buy them off Amazon. Go check it out. Is there a fail-safe chill pill that you have, like your go-to? I need to chill. This is what I do.
Yes, I go because I have a forest therapy space on my farm. I'm very thankful to live on a farm just north of Kingston in Ontario. And
Oh,
so I go out to my forest therapy space and I actually do hammock therapy with my clients. So I give myself a little bit of hammock therapy.
oh my
Um,
gosh, I'm gonna have to come all the way up to Ontario.
Please do. Yes.
Oh my
So I
gosh,
just go and I chill in the forest in my hammock and I just relax for a little bit. And that is my go-to.
that sounds divine.
I
We
recommend
all,
everybody to have a hammock in their house, in their backyard. We have multiples all around my home. So
yeah, it's a
there's
little
something to be said for it.
nervous system centering
Oh,
cocoon.
it's incredible.
Yeah. Oh my
I have
gosh.
one in my basement even for those days when I don't want to go to the forest.
Yeah. That's really good imagery, because we think about trauma posturing closing in on ourselves, but
Mhm.
also it can be very comforting to feel that sense of kind of pressure through the joints, that
Absolutely.
rocking and swinging motion for the vagus nerve. So if you've not
Yeah,
tried it, go check it out.
absolutely.
Amanda, thank you so much
Thank
for
you.
this time. You have shed so much wisdom on this. We're going to have tons of bullet points for you guys. We'll put her contact info in the show notes. Definitely reach out to her, check out her work, check out the Birth Stories book. Thank you, Amanda.
Thank you so much for having me.